Hi, we'd like to present information regarding an evidence-based treatment called Parent-Child Interaction Therapy, or PCIT. PCIT was established in the 1970s by Dr. Sheila Iberg. Since the 1970s, there have been more than 150 research studies related to PCIT. PCIT outcome research has demonstrated statistically and clinically significant improvements in the conduct disordered behaviors of preschool-aged children. After treatment, children's behaviors are within the normal range. PCIT is an empirically supported treatment for young children ages 2 to 7 who are exhibiting conduct behavior problems. PCIT places emphasis on improving the quality of the parent-child relationship and changing parent interaction patterns. In PCIT, parents are taught specific skills to establish a nurturing and secure relationship with their child while increasing their child's pro-social behavior and decreasing negative behavior. PCIT uses an assessment tool that was developed by Dr. Iberg called the Iberg Child Behavioral Inventory, or ECBI, to measure outcomes of this program. The ECBI is designed to assess parental report of conduct behavioral problems in children and adolescents ages 2 to 16. The ECBI is provided to the parent at the beginning of each session throughout the entire service. The ECBI is designed to measure the number of difficult behavior problems that the child has and the frequency with which they occur. It also measures if the parent perceives these behaviors as problems. Studies have indicated that the ECBI has good reliability and validity. The ECBI only takes the parent about 5 minutes to complete and about 5 minutes for the therapist to score. The therapist graphs the information throughout the intervention and discusses the information with the parent. The parent is also asked to complete a Parenting Stress Index, or PSI, at the beginning, middle, and end of the intervention. The PSI is a standardized measure designed to identify parent-child dyads that are experiencing stress and may be at risk to develop dysfunctional parenting and child behavior problems. The development of PCIT was based on Baumrein's development research associating parenting practices with child outcomes. Baumrein demonstrated the importance of parents meeting young children's dual needs for nurturance as well as for limit setting. She described this as authoritative parenting. Her research showed that to promote optimal child outcomes, we must focus on promoting optimal parenting styles and parent-child interactions. The intervention focuses on 2 basic interactions. The first phase is called Child-Directed Interaction, or CDI. It is similar to play therapy in that parents engage their child in a play situation with the goal of strengthening the parent-child relationship. CDI is based on attachment theory, which asserts that sensitive and responsive parenting provides the foundation for the child's sense of knowing that they will be responded to when necessary. Thus, young children whose parents show greater warmth, responsiveness, and sensitivity to the child's behaviors are more likely to develop a secure sense of their relationships and more effective emotional and behavioral regulation. CDI aims to restructure the parent-child relationship and provide the child with a secure attachment to their parent. The second phase of PCIT is called Parent-Directed Interaction, or PDI. It resembles clinical behavioral therapy in that parents learn to use specific behavior management techniques as they play with their child. The PDI draws from social learning theories, which emphasizes the contingencies that shape the interactions of conduct disordered children and their parents. Patterson's coercion theory provides a transactional account of early conduct disordered behavior in which child conduct problems are inadvertently established or maintained by the parent-child interactions. The PDI phase specifically addresses these processes by establishing consistent contingencies for the child's behavior. One distinguishing feature of PCIT is its intense delivery by using direct coaching of parent-child interactions. The principles and skills for both CDI and PDI are introduced during one teaching session at the beginning of that phase. The teaching session is conducted between the therapist and the parent without the child present. In subsequent sessions, the therapist coaches the parent interaction skills with both the parent and child present. In clinical settings, coaching is done by using a wireless earphone from an observation room. In the in-home setting, the therapist sits near or behind the parent so they can clearly see what is happening with the parent and child. The therapist speaks in a low to normal voice to the parent and ignores the child. During the CDI portion of the intervention, the parent is taught to use the PRIDE skills during what is called special playtime. During special playtime, the basic rules of CDI are for the parent to avoid giving commands, avoid questions, and to avoid criticism. The therapist teaches the parent to use PRIDE skills. The P in PRIDE stands for praise. The therapist coaches the parent to give labeled praises for positive behaviors. R is for reflection. Here, the parent learns to reflect the child's appropriate talk. I is for intimate. The parent learns to imitate exactly what the child is doing to help keeping the child's attention and allows the child to lead. D is for description. Here, the parent describes the positive things the child is doing. And E is for enthusiasm. Enthusiasm lets the child know that the parent is enjoying spending time with them. The parent is also taught to actively ignore minor misbehaviors. This serves to decrease attention-seeking behaviors by not rewarding poor behavior. The parent is told to end special playtime if the child exhibits aggressive or destructive behaviors. Finally, the parent is asked to practice CDI for 5 minutes every day. The therapist assesses the parent's progress by coding each of the PRIDE skills at the beginning of each session. In order for the parent to achieve mastery of these skills, the therapist must observe the parent give 10 labeled praises, 10 reflections, give 10 behavioral descriptions, and is not allowed to ask any questions or give any commands during the 5-minute coding period. Later, at the end of the PDI phase of PCIT, the therapist will ask the parent to include 4 direct commands during the coding period. The parent must meet the minimum standard to reach graduation from the service. For PDI, the parent is taught how to give commands that are clear rather than indirect. Direct commands make it absolutely clear that the child is being told, not asked. Direct commands should also make it clear that the child is the one who is expected to do the task, not the parent, or both the parent and the child. For example, put the puzzle away, instead of, let's put the puzzle away, or we're going to put the puzzle away. The parent is encouraged to use only one command at a time. They should be age appropriate, given in a normal tone of voice, and to be specific. Specific commands tell the child what to do. For example, saying, use your quiet voice, instead of, hey, you need to settle down. After the parent gives us effective command like, please hand me the puzzle, they allow 5 seconds for dawdling or whining. If the child complies with the command, the parent gives the child a labeled praise. However, if the child does not comply, after quietly waiting for 5 seconds, the parent then tells the child, if you don't hand me the puzzle, you will have to sit on the timeout chair. The parent immediately starts to count to 5 out loud. If the child complies before reaching 5, the parent gives the child a labeled praise, just like before. But if the parent reaches to 5, and then they tell the child, you didn't do what I told you to do, so you will now have to sit in the timeout chair. The parent takes the child to the chair and tells the child, stay on the chair until I say you can get out. After 3 minutes plus 5 seconds of quiet time, the parent returns and says to the child, are you ready to hand me the puzzle? If the child says no, or doesn't answer, the parent tells the child to stay on the chair until the parent tells them they can get off. The parent repeats this step until the child agrees to comply. At that time, the parent gives an unlabeled praise and gives another simple command like, thank you, now hand me the red block. When the child obeys the new command, the parent gives an enthusiastic labeled praise for quick compliance, such as, thank you for minding so quickly. When you listen so well, we can keep playing.